You have to have a prescription from a doctor to get birth control. But if this bill is passed, a patient could go directly to a pharmacist for the medication instead. Tennessee lawmakers don't have the power to make birth control available over the counter, but soon it could become an option behind the counter. The bill would allow patients to go to their pharmacy for hormonal contraceptives.
Statistics show that between 47 and 50% of the pregnancies are either unplanned or mistimed.
Republican Representative Patsy Hazelwood of Signal Mountain is the House sponsor of the bill. She's trying to make birth control more accessible and more affordable for women.
But we're giving them the ways to manage and control their family expansion. So without having to do something much more invasive to terminate a pregnancy.
Pharmacists would have to enter into collaborative agreements in order to provide birth control, meaning they'd be working under the authority of a physician. Collaborative agreements already allow pharmacists to offer services such as flu shots. On top of that, pharmacists would be required to complete a training program and give the patient information on all of their options.
But it'll be interesting to see how thorough it is as far as background information, because there are serious risks with contraceptives. There are clot risks and there's some cancer risks.
Pharmacist Jordan Morrison says he's concerned because the bill prohibits pharmacists from asking a patient to schedule an appointment to discuss the birth control. He worries chain pharmacies with a lot of customers wouldn't take the time to discuss all the pros and cons.
Those pharmacists aren't going to be able to handle in a great manner seeing that patient, making sure that the right product is selected and then it's done with the patient's best interest in mind.
Tennessee women are savvy and they'll be cautious with their own bodies as well.
Insurance would still cover birth control provided by a pharmacist. Pharmacists can charge an annual administrative fee, but patients with insurance wouldn't have to pay. Josh?
Catherine, thank you. The spokesperson for the Tennessee Pharmacy Association told us the group does support the bill.
The Senate approved the bill, but it still has to pass the entire House to become law.
U.S. Supreme Court today heard a case over contraceptives in President Obama's Affordable Health Care Act. It is one of the 7 lawsuits combined into a case heard by the justices today. Included in the lawsuit